side is going to pump blood to the lungs. This side is going to pump blood out to the body. Okay? The rest of the physiology I'll do later. So we're going to start in the right atrium. Models always make it open, a room. Understand that when I look at a real heart, the atria lay on top of the heart like a balloon with no air. Okay? This is the atrium. This, see where it's wrinkled where the number 2 is? That's the auricle. What the auricle does, if it were laying flat like a balloon, that's what allows it to stretch when it fills up with blood. There's not a whole lot really going on in the right atrium, but you've got the right atrium, the right auricle. See these lines here? This is pectinate muscle. Right? These lines are pectinate muscle. The atria don't squeeze blood the whole time. Most 70% of the blood just drops by gravity into the ventricles. It squeezes out the last 30%. That's why it's not real muscular. So I have the right atrium, the right auricle, and the pectinate muscle. See that number 55 right there? That little depression? See it? That little depression is the fossa ovalis. It's important in a fetus because that's open and blood goes through there. And we'll talk about that when we do the circulation. And then I have this valve. This valve has got 2 names. It can, or 3 names. It can be called the right atrioventricular valve. It can be called the right AV valve, or it can be called the tricuspid valve. See the 3 little tails? That's why we call it the tricuspid valve. It's called AV because it's between the atrium and the ventricle. This is the right ventricle. Blood goes from the right atrium into the right ventricle. In the right ventricle, I have the tricuspid valve. When you look, see the little strings right here? That's called chordae tendineae. Means heartstrings. And the chordae tendineae are attached to those little muscles. See where it says 62? Right? That's a little muscle. And that little muscle is called the papillary muscle. What happens is when the ventricle is going to squeeze, I don't want that valve to turn inside out. And that papillary muscle hangs on to the chordae tendineae to keep the valve from turning inside out. Remember when we did the skeletal system and we looked at the spongy bone and we had the trabeculae? Well, this is trabeculae in the heart, and so because it's not bone, it's meat, we call this a trabeculae carneae. Trabeculae allow it to take stress from a lot of different directions, but it also gives it a little bit of stretch, so it can do this. Okay, that's a trabeculae carneae. Blood is going to leave the right atrium, the right ventricle, and go out through this valve. This is the pulmonary semilunar valve. Goes out through the pulmonary semilunar. See that little pale, kind of orangey colored area? That's the conus arteriosus. Now this, any blood vessel leaving the heart is an artery. So this, even though it's blue, is an artery. We call it the pulmonary trunk. But from the pulmonary trunk, it goes to the right and left pulmonary arteries. Right and left pulmonary arteries. Got it? Goes to the lung and picks up oxygen. Comes back to the heart via the right and left pulmonary veins. When it comes back to the left atrium. Now this really is boring because it doesn't have anything in there except the openings for the right and left pulmonary veins to dump into the left ventricle, left atrium. This is my left atrioventricular valve, or my left AV valve, but it also has 2 other names. It's called the bicuspid because it has 2 tails, see them? So it's called the bicuspid valve. But it's also called the mitral valve. See how it looks like the Pope's hat or the bishop's hat, the little pointy hat? That's a mitre. That's why we call it the mitral valve. Blood's going to drop into the left ventricle. Again, I have the chordae tendineae and I have the papillary muscle. I have the tuberculi carne. It's going to leave the left ventricle. I got to move this out of the way. Look, way up here. Way up there. See that valve? It's going into the aorta. That's the aortic semilunar valve. And it comes into the aorta. See it way over here? Way over there. Okay. You see it, Stacy? Way over there. Okay.
What's that called?
That's the that's
The aortic.
aortic semilunar valve. Okay. Now, when it leaves the aortic semilunar valve, it comes into the aorta. This is the ascending aorta. This is the aortic arch, and this is the descending aorta. Now, at some point, we changed the name to the thoracic aorta, but there's nowhere I can say right there it changes. So when we do this, you can either call it the descending aorta or the thoracic aorta. Okay? Now, see these three blood vessels? Take your right hand and put it right here, just like this. When you do that, this is the brachiocephalic trunk. This is the left common carotid, and this is the left subclavian. Brachiocephalic trunk, left common carotid, and the left subclavian. The next topic after this will be physiology of the heart and the blood vessels. If we know these three, you can learn all the blood vessels in the upper extremity like that, but you've got to know these three. Coming right off of the aortic arch, right out of the heart. Brachiocephalic trunk, left common carotid, and the left subclavian. If we look at the blood vessels, and I go from right to left, this part right here is the superior vena cava. Not these. This is the superior vena cava. This is the inferior vena cava. This is the pulmonary, this is the ascending aorta, the aortic arch, and the descending, and this is the pulmonary trunk. Okay? Now, this, can you see the triangle? You look at the triangle, this is the apex of the heart. This is the base of the heart. The heart has three layers. It has the endocardium that covers everything on the inside. Covers the valves and the tuberculi carne, covers everything, endocardium. Then it has the myocardium. The myocardium would be all of this. It's the muscle. It's the muscle of the heart. And then we have the pericardium or the epicardium that covers the entire outside of the heart. So tight to the heart, I can't dissect it off. Got it? All right. Then we do the circulation. Blood came into the right atrium, went down to the right ventricle, out the pulmonary trunk to the lungs, picked up oxygen, and came back. Came back to the left atrium, to the left ventricle, and out the aorta. Heart didn't get any of it. It was just passing through. But the heart, guys, is like a woman that says, I did all the work, I'm getting something. Okay? That's why they get those diamonds on their rings and their fingers and stuff. All right. So what the heart does is the very first two blood vessels off the ascending aorta is the right common carotid and the left common carotid. Now look, this is the right common carotid artery. Just that little bitty piece right there, that little bitty piece right there, before the split, see it right there? Just that little bitty piece is the left common carotid artery that you can see. Because most of the left common carotid artery is behind the pulmonary trunk. So I'm going to come out the right coronary artery, and I'm going to go down along this groove, the sulcus. Listen to my words. I come down here, and I've got this red one running right along the margin of the heart. See it? That is the marginal artery, or the marginal coronary artery. Sometimes we just say marginal artery. I'm going to go all the way around to the back. See this one going right, this one right here? This is the posterior interventricular artery, the red one. I come over here. Now I'm over here at the left coronary artery. The one going straight down is the anterior interventricular artery. The one going around the circumference of the heart is the circumflex artery. Now, if you look at this wall is called the interventricular septum. It means the wall between the ventricles. There's also a wall up here between the atria called the interatrial septum. We call this one the posterior interventricular artery because it's laying on the back of that interventricular septum. We call this one the anterior interventricular artery because it's laying on the front of that interventricular septum. Okay? One more time. Right coronary artery comes down, and I have this one running along the margin of the heart. This is the marginal artery. Go all the way around the back. There's my posterior interventricular artery. Come to the front. Come straight down. This is my anterior interventricular artery. And the one going around the circumference of the heart is my circumflex artery. Then we go back and do the veins. Well, the arteries are coronary. The veins are cardiac. I come down the right coronary artery, and it shows one, there's really several that come across. It's coming right across the front of the heart. Front is anterior, so this is my anterior cardiac vein. See the small